Aloha Kauai, this is your weekly County of Kauai briefing for Monday, October 25th. We are seeing an increase in cases due to in part to fall break travel by residents. We now have 2 active clusters on the island that were started by residents who traveled off island. If you traveled in the past 10 days, please get a free COVID test to avoid unknowingly spreading the disease. Ideally, we recommend getting tested 3 to 5 days after travel, even if you are vaccinated and have no symptoms. The vaccines are highly effective against severe illness and death, but it is still possible to catch and spread the virus while asymptomatic. Free tests are available without a doctor's order or insurance at the Convention Hall, Lihue Pharmacy, and from our mobile van. Visit kauai.gov/COVID test for details. If you do have any symptoms, stay home. One sick person at school or work can start a cluster. And if you are a manager or business owner, insist that your employees stay home if they are sick. If you do test positive, don't wait for the Department of Health to call. Isolate yourself at home and let your close contacts know they've been exposed and should quarantine. Mahalo everyone for doing your part to keep this community safe. Now for the latest on our daily case count and clusters. We turn to Kauai Deputy District Health Officer Lauren Guess.
Thanks, Mayor. Over the past week, our average daily case count was 8 cases per day. Today, the Kauai District Health Office is reporting 10 new cases, all residents, including 2 children and 8 adults. 4 of the cases are related to mainland travel, and the other 6 cases are considered community acquired. The clusters DOH has been monitoring for the past few weeks are no longer active. We are announcing 2 new active clusters today. One cluster is associated with travel to a neighbor island for a place of worship event. The other cluster is from a social gathering associated with group travel to the mainland. We will continue to monitor these clusters in the coming days and weeks. Today's cases bring the number of active cases to 76, with 3 hospitalized. Since the beginning of the pandemic, Kauai has seen 2,628 cumulative cases, with 12 fatalities.
Thanks, Lauren. We want to give a big mahalo to Corteva AgroScience, Hartung, the Kekaha community, and all who worked hard to provide free pumpkins to our keiki from Kilauea to Kekaha. We're looking forward to Halloween this weekend, and we want everyone to have a safe, enjoyable, and spooky evening. A lot of parents are asking what's safe for kids to do this year. For details, we turn to Kauai District Health Officer, Dr. Janet Berriman, for Ask Dr. B. So, Dr. B, is it safe for our kids to trick-or-treat this year?
Thanks, Mayor, and happy Halloween, everyone. Yes, trick-or-treating outdoors is fine, with a few common sense precautions. Being outdoors is a great first step. We know COVID spreads more easily indoors. We recommend trick-or-treating in small groups and avoiding crowded indoor parties. For extra protection, consider including a cloth or surgical mask in your child's costume. Most Halloween costume masks aren't designed to prevent the spread of COVID, so don't rely on a costume mask as a substitute. For traffic safety, choose bright colors and consider adding reflective tape if you plan to be out after dark. If you're handing out treats, set up outdoors and individually prepackage the treats. Finally, if you're sick, even with mild symptoms, stay home and don't interact with the trick-or-treaters. If your children are sick, please keep them at home. We're looking forward to seeing your creative Halloween masks and costumes out there.
Thanks, Dr. B. That's exciting news for our Keikian families. We strongly recommend that everyone 12 and older get vaccinated if you aren't already. Dr. B, do we know when kids younger than 12 will be able to get a vaccine?
The Pfizer vaccine is expected to be approved and available for children ages 5 to 11 within the next few weeks. The U.S. Food and Drug Administration is reviewing the results of Pfizer's clinical trials, assessing the safety and effectiveness of their vaccine in children ages 5 to 11. If the FDA approves the vaccine, the CDC will review the data and make its recommendation. After the FDA and CDC grant final approval, the vaccine will become available for children 5 to 11 years old. That's likely to be sometime in November. The children's vaccine is the same formula as the vaccine for adults, but the dose, and the needle and syringe used for the injection, is smaller. Although children are less likely to have severe COVID symptoms, some do require hospitalization, and there have been deaths in young children from COVID-19. Even children who are less seriously ill can have prolonged symptoms, and they miss school and other activities during their illness. And of course, children can spread disease to others in their household. The long-term effects of COVID disease on children are still being studied. We highly recommend protecting your keiki by getting them vaccinated when the vaccine is approved. For children younger than 5, clinical trials are still underway and approval is not expected anytime soon. We can help protect our youngest keiki by being sure everyone around them gets vaccinated and by following safety guidelines like wearing masks indoors and staying home when we're sick.
Thanks, Dr. B. I know a lot of parents are looking forward to their kids being vaccinated and protected from the long-term effects of COVID-19. Finally, we've been getting a lot of questions about boosters. The federal government expanded eligibility for boosters last week. Who is eligible now, and who do you recommend sign up for a booster?
The U.S. Centers for Disease Control and Prevention last week issued booster recommendations for all 3 available COVID-19 vaccines. Eligible individuals may choose which vaccine they receive as a booster. Some people may have a preference for the vaccine type that they originally received, and others may prefer to get a different booster. CDC's recommendations now allow for this type of mix and match dosing for booster shots. If you received the 1-dose Johnson & Johnson vaccine, the CDC is recommending boosters for everyone 18 and older who was vaccinated at least 2 months ago. If you got the Pfizer or Moderna vaccines, only certain groups are eligible for a booster at this time. Kupuna age 65 or older are all eligible. Adults 18 and older are eligible only if you live in long-term care settings, have underlying health conditions, or work or live in high-risk settings. I want to emphasize that while the boosters will provide some additional protection, all 3 vaccines continue to be highly effective in reducing the risk of severe disease, hospitalization, and death, even against the Delta variant. Getting your initial doses remains the best way to protect yourself and reduce the spread of the virus. Getting vaccinated also helps prevent new variants from emerging. The vaccines are very safe. Over 400 million vaccine doses have already been given safely in the United States. They're the key to getting back to our normal lives. Mahalo to everyone who is vaccinated or planning on it. All 3 vaccines will remain available island-wide. The Department of Health will not be reopening the vaccine clinic at Kauai War Memorial Convention Hall. Mahalo to our hospital and pharmacy partners for their continued efforts to provide vaccinations for our residents. For a list of clinic locations and additional details, please visit kauai.gov/vaccine.
Dr. B, I have a follow-up question. Do I need my booster dose to be considered fully vaccinated?
That's a great question, Mayor. No, you don't need a booster dose to be considered fully vaccinated. If you've completed your initial series, you are still considered fully vaccinated.
Thanks, Dr. B. Post your questions for Dr. B on our County of Kauai Facebook page and we'll answer more next week. First doses, second doses, and boosters are widely available on Kauai. Most pharmacies and clinics accept walk-ins for first doses. Appointments are required for boosters. If you got your vaccine at the Department of Health clinic at the convention hall, please note that this vaccine clinic is now closed. The testing center there is still open. To sign up for a booster, just make an appointment at any pharmacy or clinic on the island. For a full list, visit kauai.gov/vaccine. If you're ready to start your vaccination, you're welcome at any of our mobile clinics. Minors must be accompanied by a parent or guardian. No appointments are needed. All 3 vaccines are available. Again, for a full list of locations, kauai.gov/vaccine. As we mentioned earlier, if you traveled off island recently or if you think you may have been exposed, please do get tested. We provide free testing with same-day results. The convention hall is still open for COVID testing on weekdays from 8 to 3:30. No appointments are needed. Our mobile van goes to Kekaha on Wednesdays, Kilauea on Thursdays, Kalaheo on Fridays, Hanalei on Saturdays, and Kapa'a on Sundays. It is open from 9 to 1 each day. Lehue Pharmacy provides free tests with an appointment by visiting preventcovidhi.com. Tests are also available with a doctor's order at Wilcox, KVMH, Lehue Pharmacy, and clinical labs. For a full list, visit kauai.gov/COVID tests. Statewide emergency rules continue to limit gathering sizes to 10 indoors and 25 outdoors. Masks are required indoors. Trans-Pacific travel rules remain in place. Professional event organizers must submit their plans in advance at kauai.gov/COVID-19. Organizers who violate these rules are subject to a $500 fine. Individuals are subject to a $250 fine. If you see a violation, please call KPD. Mahalo, Kauai.